Welcome to the T-Level Health Core Assessment Employer Set Project Task 2A Role Play Overview. In this presentation, we will guide you through the details and key considerations for Task 2A. Please remember that information provided here is based on data available as of September 23 and may not reflect future changes to guidance documents. Always refer to the most up-to-date guidance. Task 2A, the role play, is an integral part of the ESP. Let's delve into specifics. In this task, students will continue to act as a supporting health worker within a multidisciplinary care team. Students' role is to assist in achieving individual care goals, still following the healthcare journey of one individual. Task 2A occurs within the 2-week assessment window and has multiple components, totaling 2 hours. This includes time for preparation questions, a 30-minute role play with tutor feedback, and 1 hour for reflection and clarification. Students will work under supervised conditions and have access to research from the pre-research activity. Additionally, students will have access to questions for discussion, a feedback performer, and audiovisual recording equipment. Students' evidence for this task includes the written questions and notes from the role play discussion and a video recording of the discussion with the individual. Understanding how Task 2A fits into the broader project is essential. In the preparation research, students continue to focus research on their current brief, but also consider what evidence they'll need for upcoming tasks. Using their preparation research in Task 2A, they will create questions for the supportive discussion. The post-discussion reflection time is crucial not only for taking notes on the discussion, but also for reflecting on their performance and all tasks so far. For Task 2B, this is where they'll create a healthcare plan. Their project is now beginning to take shape, utilising their notes from supportive discussions and reflections on Task 2A to build a comprehensive healthcare plan. In Task 3B, students will need to bring all these components together to justify the actions they are implementing and consider what changes they'll make based on feedback. And finally, for Task 4, they'll reflect on whether they used their pre-research effectively and build a solid foundation for their discussion. Were they prepared for the supportive discussion in their role play? This task links to CS1, demonstrate person-centered care skills when planning, developing and providing care to ensure the need of individuals are met, and CS2, communicating, being able to communicate effectively with patients, carers, service users and other health and social care professionals using a range of techniques to overcome communication barriers. To maximise success in this type of assessment and to demonstrate these skills, students should consider the following tips. Effective greetings and introductions. Set the scene for discussion. Create a supportive and person-centered environment. Clearly introduce themselves, their role and objectives in working together. In gathering relevant information, students ask open-ended questions beyond what's in the case study. Students should inquire about required support, health concerns, preferences, values, needs and short or long-term goals. Questions should be well considered to inform care planning. Students should have a clear understanding of their role. They are supporting healthcare assistants and not a prescribing GP. Refrain from discussing medication as that is beyond their professional boundaries. If other professionals are needed, inform the individual, include this in the healthcare plan. In gathering information from the brief, students should research and extract relevant details from the individual's brief. Use this information to ask insightful questions during the discussion. In regards to contributing to a healthcare plan, students identify the individual needs based on the brief, including physical requirements and preferences. This contributes to the development of a comprehensive healthcare plan. Students also need to demonstrate effective communication with the individual, adapting communication techniques to meet the individual's needs and overcome potential barriers. Use preferred communication methods, explain ongoing care needs, and be mindful of tone and body language. And finally, students should show respect, compassion, and sensitivity regarding the individual's equality, diversity, human rights, and dignity. Respect privacy, maintain confidentiality, ensure information sharing aligns with the individual wishes. Establish clear and agreed upon expectations, including professional boundaries and referrals. These points cover the essential aspects of conducting a discussion and gathering information effectively while respecting professional boundaries and the individual's rights and preferences. Now we're going to explore how to maximise student success using the Autumn 23 Grade A exemplar alongside the descriptors for Band 3 and 4 marking criteria and the examiner commentary for the task to highlight key areas that can maximise success. Use this in an example process. This could also be applied to the C and E exemplar, giving a way to measure student achievement. So the Chief Examiner's commentary on the student's work can be summarised and cross-referenced with the grading bands and indicative content as follows. So the student clearly showed application of a holistic approach, demonstrated excellent understanding and application, showed compassion, respect and sensitivity throughout the role play, builds on John's knowledge effectively and established his care needs comprehensively. In the exemplar, students showed an excellent understanding of communication approaches, skillfully adapts verbal and non-verbal communication to meet John's needs, shows excellent listening skills and had a warm introduction. The student also demonstrated Band 4 criteria in relation to understanding of their role. They demonstrated an excellent understanding of the role in the team and its scope in relation to the care planning process, and explained her role as a healthcare assistant. In relation to the knowledge of principles of collaborative working and knowledge of the role within a multidisciplinary team, the student did evidence grading Band 3 criteria. Greater technical knowledge regarding the collaborative approach of the muscular dystrophy team and the roles of others within this team is needed. Specifically, understanding of the role of an occupational therapist is significant for this case study, and this would allow for a stronger evidence-based practice. The student's performance showcases a blend of excellence in communication and care approaches and good technical knowledge with room for improvement. So the overall grading is Band 4, reflecting a strong performance with potential for further enhancement in technical knowledge. So now let's look at overall at the key themes in Task 2 of the Health Core ESP. Students demonstrated a strong grasp of their role, leading to more effective interactions during the role play task. This understanding contributed to the collection of valuable information for later tasks. Many students were able to clearly articulate both what they could offer to their client and their limitations as a healthcare assistant. This awareness of boundaries was evident in their interactions. Several students exhibited advanced communication skills, showcasing not only their knowledge, but also empathy, kindness, and adaptability. They employed sophisticated questioning techniques and reduced reliance on prompting from the client, resulting in meaningful discussions. Many students used the role play interaction as an opportunity to gather relevant information to inform their healthcare plan, demonstrating a practical understanding of the purpose of the exercise. Some interactions lacked depth due to overly simplistic questions that elicited yes or no answers or basic information. This hindered the ability to gather meaningful insights for healthcare plans. And brief interactions often indicate insufficient planning, resulting in missed opportunities to collect necessary information. This impacted the attainment of high marks. So in summary, emphasizing the importance of person-centered care skills in assessment tasks, highlighting the significance of creating a supportive environment and clear introductions, stressing the need to gather relevant information by asking open-ended questions, understanding and adhering to professional boundaries, clarifying the role of the supporting healthcare assistant versus a prescribing GP, emphasising the importance of refraining from discussing medication beyond one professional boundaries, and encouraging communication with other professionals. Promoting advanced communication skills, including adaptability, empathy, and effective questioning techniques. Recognise the importance of listening actively and reducing reliance on prompting. Highlighting the role of warm introductions in building rapport. And finally, effective information and gathering and planning. Encourage students to use role play interactions to gather relevant information for comprehensive healthcare plans. Identify challenges related to oversimplistic questioning and insufficient planning. Acknowledging the impact of effective information gathering on the overall assessment. Thank you for watching. We wish you the success in the T-Level Health Core Assessment Employer Set project.